It's that emotional toll that has probably been the most difficult for our healthcare heroes. And yes, there was a time that we thought of them as that, as heroes. That warm and fuzzy feeling has seemed to have worn off lately all across the state of Idaho, which is why Dr. Kenneth Krell, an ICU doctor at Eastern Idaho Regional Medical Center in Idaho Falls, did what he did last weekend. Dr. Krell, who is 71 years old and currently working a 36 on 12-hour off shift, was called into work last weekend because, well, they were so busy. It was in the middle of his time off. And driving in that morning, he said, he thought of something he wanted to tell his coworkers. So he wrote it on the whiteboard when he got there. In the end, what sustains us and what we will remember about having survived this madness are the remarkable people who endured this with us. The best of humanity, all of us, who demonstrated the best of our calling. We endured this together and supported each other. We saved lives and lost lives, and we did both with compassion and competence. We will never forget this.
That's the way I feel. And I never intended for this to be spread to anybody outside our immediate staff, of course. But I think it did resonate with other healthcare workers. And I'm pleased that maybe that gave a little boost to all of us who are under the worst circumstances we could have ever imagined.
Have you had some of them that have struggled with that, like wondering this, like Sisyphus, like this uphill battle that never seems to end?
We all struggle with that. You can't be human in healthcare at the moment and not struggle with wondering what you're about, why you're doing this, what good you're doing, given what circumstances we're under and what we're seeing in the community, which feels very much like complete lack of support. That we've gone from a period last winter where people were praising healthcare workers to more often now, it often feels like we're admitting patients with COVID who yell at us that they can't possibly have COVID because it doesn't exist. And patients getting angry if we ask them whether they were vaccinated. To patients saying, I can't possibly have COVID, I took ivermectin. So we do have to remind ourselves what we're about, why we're here, and why we're in this war.
Eastern Idaho Regional Medical Center has 29 ICU beds. Dr. Krell told us today they are always full these days. In fact, there have been days where they've had to put patients in the infusion center, in recovery rooms. Some have even stayed overnight in the emergency room until a bed opened up in their ICU. As you heard, that message was meant for his colleagues. But one of them posted a picture of it on social media, and it was seen and reposted by an Idaho Statesman reporter yesterday. And since then, that picture of that message has been seen more than 1.1 million times. And hopefully, by those in the healthcare profession who could really use a message of the best of humanity doing what they could be capable of doing right now, who could really use that message of hope right now.